So before we started doing Zest locators, Zest fixed locators.
Right.
What did you feel that we had a difficulty treatment planning some of the patients that came through the door?
So the thing that was frustrating to me, and I think you saw it too, when we're doing our consults, it was an either or,
yeah,
and not an and so that it was like either you do a snap-on or you do a screw retained, and the price differential was substantial. And the patients kept asking, well, isn't there something else we could do? Isn't there another way we could do? Isn't there some form of intermediary as far as cost and being able to get into a fixed solution?
Yeah, the frustration with it was a snap-on, again, it's a glorified denture.
It is, and that's the thing, having done this for as many years as we have, it's like, people come in thinking, oh, I get 2 implants, snap-on denture, it's gonna fix everything. And it's like, no, it's still gonna walk and talk like a denture. Yeah. It's just not gonna go flying out of your mouth as easily. So it's not creating that huge benefit of a fixed type solution.
So we had a gap there.
Totally.
Every single time with the patient, and it was kind of frustrating. To me, especially when I'm talking with patients.
Especially because again, how many times did we deal with doing snap-ons? And a lot of times you were dealing with patients having to come back for a number of appointments because they still were getting sore spots, or it's not staying in because they kept thinking that it shouldn't come out. And
I push it out with my tongue.
Yeah, I mean, I push it out.
Stop doing that.
Dang tongue, man. And that was such a frustrating component within the practice because with some patients, the snap-ons work great. But with some patients, high level of frustration and dissatisfaction.
Then here's the question. How does Zest Fixed fill the gap?
Well, it's very clear. Basically, you're vetting patients and they qualify based off of what their bone's looking like. If you can get 4 implants in a good AP spread, price point wise for us, as far as our costs, and price point wise for the patient, it can be very profitable within our practice, and yet it's very cost effective for the patient. Yeah. So it's a win-win for everyone.
Yeah, it's been awesome. It's been awesome to see the patients when they're done.
Yeah, for sure. When they're going from something that's moving around to that fix, that's a big deal.